Good afternoon, good afternoon, good afternoon. We're back. We're back. It's another Friday. Thank God it's Friday. Thank God it's Friday. End of another week.
Yes.
Yes. And ladies and gentlemen, welcome to the CareSouth Carolina Community Live Podcast. I am one of your hosts, Mark Calhoun. I'm the Director of Social and Community Services for CareSouth Carolina with my partner in crime, as always.
I am Daniel Myers, the MAT Program Director for CareSouth South Carolina. Just glad to be back. Glad it is Friday. I'm just all around glad that we got sunshine, no rain. Just
I
happy.
know. Yes, it's a beautiful day out there. It's a little nippy, but overall, it's a beautiful day. And we have a special guest in the building, backed by popular demand. Backed by popular demand. This is her second time on the show, and we can't be more happier to have her here. We're talking the one, the only, Dr. Jan Kelly. Right?
Yes, yes.
Dr. Jan Kelly. So, we're going to, for the folks that don't know who you are, this is your second time on the show. You're definitely a friend of the show. And for those who don't know you, um, could you introduce yourself and tell them a little bit about yourself, who you are, and what you do?
Sure. So I'm the Assistant State Epidemiologist at South Carolina Department of Health and Environmental Control. And what that means, epidemiologist means you study outbreaks of not just infections, but other things, worrying about public health, trying to keep everybody healthy in terms of car accidents or, what can we do to, make sure people are safe during disasters, things like that. But right now, 110% of my time is focused on SARS-CoV-2, COVID-19, and a lot on vaccines. And I'm so glad you opened with, good day, because this is an extremely good day on two fronts. One, we've got enough vaccine that we're moving into phase 1B, and hopefully we'll talk a little bit about what that means. And number two, I hope you've heard that the Johnson & Johnson vaccine, which is also sometimes called the Janssen vaccine, it's here. It is in pharmacies in South Carolina. So we now have 3 different vaccines available. So this is a good day for sure.
Yes.
Yes, absolutely. And that was one of the reasons why we were so eager to get you on. Me and Daniel here were talking. We said, what we're going to do for the show for this week. And we was like, and Daniel was like, we probably need to get someone on to talk about, because we knew, he let me know we were getting ready to move into phase 2, phase 1B, and I said that'd be a great idea. So let me reach out to Dr. Kelly. She's a friend of the show. She always come through for us, and we were sitting there with our fingers crossed, legs crossed, everything crossed, and you hit us right back.
You guys crack me up. I love working with you. But it is. Yeah. We've got great news this week. This is big news.
Yes. So yeah. So Daniel, I'm gonna let you take it away, my brother.
All right. So we understand that there was a lot of people asking questions ever since we started giving vaccines. Well, when is going to be my turn? What are we going to do? A whole bunch of different stuff. When the vaccine started, what's in the vaccines? It was just a whole bunch of questions, Dr. Kelly. And some questions we could answer and some questions we couldn't. So we figure it's best to leave those type of things to the experts so that they get the correct information and that they are properly educated. So who better to get than the one and only Dr. Jan Kelly to come back and give us a big overview of everything that's happening, everything that's going on, what's in the vaccine, everything. So I'm just excited to hear what you got to say.
Great. Well, thank you. I think every day we are all learning more about this virus, more about, vaccines. Every day it's a learning process. So just want to remind people about that, each day we come out with, when there's new news, new scientific research, sometimes some new facts are going to come out. But I'm happy to talk about what we know, where we are right now with phase 1B, and what we know about what's in these vaccines. So which one you want to take first?
Well, I guess since people are taking the vaccine, let's find out what's in them first.
Okay. So I think we might have a visual showing a little bit about what's in these vaccines. So there are 3 different vaccines out there. There's the Pfizer vaccine, which is it's a 2-dose vaccine. You get 1 dose, then 3 weeks later, you get your 2nd dose. And then there's the Moderna vaccine. 1 dose, and then 4 weeks later, you get your booster shot. Now, when I say 3 or 4 weeks, it can stretch out a little bit longer than that. The vaccine will still take, if you don't get the second shot, until 6 weeks later, for example. But we recommend try and get it early on, at that 3 or 4 week point. So the visual I'm showing are what are the ingredients in that Pfizer and Moderna vaccine. Those two vaccines are actually very similar. They both use just a little piece of the genetic code of the virus. So there's no whole virus in these vaccines. You cannot get COVID-19 from their vaccines. It doesn't have the entire virus, weakened or something like that in there. All it's got is a piece of genetic code, the gene for a certain protein, and it's called messenger RNA, mRNA. It carries the message for making that one particular protein. Now, why that protein? That protein, called a spike protein, is the part of the virus that attaches to the cell, and it's almost like a key in a lock that it opens the door and then the virus can get into the cell. So they put just that gene in there. And then the other ingredients are a lot of common things: sugars, salts, lipids, which are like oils to kind of coat that messenger RNA so that enzymes in your muscles, when you get the shot, don't break it down. It has a chance to get into your immune system. And both of them have a special ingredient that I've noted there, polyethylene glycol. Now, that's also a kind of oil, a lipid, but it's found in a lot of over-the-counter products. It's found in a lot of over-the-counter laxatives, for example. So I know it's a chemical name, but it's not an unusual ingredient. It's used in lots of different things. However, it's probably the one that's giving people some severe allergic reactions or anaphylaxis. You've probably heard about a few people getting a severe allergic reaction after the vaccine. I want to remind people that a severe allergic reaction to these vaccines has happened in about 3 to 5 people per million doses of vaccines. So it's a rare thing. And it's kind of on the par for the course for other vaccines. Flu vaccine, you get about 1 in a million people get a reaction like this. For pneumovax, the pneumonia vaccine, it's closer to 3 in a million. So yes, that's a complication. But I want to remind people that if you got a severe allergic reaction, it's treatable. Any place that is giving vaccine also has the medications and the expertise to treat it if you get an allergic reaction. I also want to emphasize that that's it. That's all that's in these vaccines. So Pfizer and Moderna, no aluminum, no mercury, no antibiotics, no, people may have heard the word adjuvants. There's no adjuvants, there's no egg, no preservatives. It is just these, they tried to keep this as simple as possible. So that's for Pfizer and Moderna. And Johnson & Johnson, or the Janssen vaccine, is similar in some ways and a little different in others. If you just show that next one, we've got it for what's in the Johnson & Johnson vaccine. If you go to that next slide, thank you. So a little bit about naming. Johnson & Johnson is a big company, right? They make all kinds of different products. Janssen is the little company inside Johnson & Johnson that makes pharmaceuticals, makes vaccines and medicines. So that's why sometimes it's called Janssen, sometimes it's called Johnson & Johnson. There's only one additional vaccine out there. So there's only 3 vaccines: Moderna, Pfizer, Janssen. Now, what's different about this one is instead of using, they're all working on the same basic principle of having no whole virus. There's not a COVID-19 virus in this vaccine. It just has that gene for the spike protein. They do it a little differently. They do it using DNA instead of RNA. And the reason they do that is DNA only needs to be kept at refrigerator temperatures. So that Pfizer and Moderna, those are the ones that you read about, like Pfizer had to be kept in the super cold freezer. They both need to be kept in the freezer. They only last just so long once they're defrosted. The nice thing about the Johnson & Johnson vaccine is you can keep it in the fridge for months. So that's really nice if you're trying to get it out to small communities or mobile clinics. What are the other ingredients in it? Well, salts and sugars and lipids, just like the others, because you've got to keep that gene protected long enough for it to get into the immune cell. It also has two other things. Remember that polyethylene glycol I mentioned that people are having allergic reactions to? This does not have that. It has a different ingredient, something called polysorbate 80. Again, big chemical name, but it's a common ingredient in ice cream, in salad dressing. Basically, it changes the texture of something. It's a little bit oily, makes it more slippery. Some people are allergic to polysorbate 80. If you're a person who has a lot of allergies, whether it's to peanuts, shellfish, or allergies to penicillin or another medication, or if you've had a really bad allergic reaction to another vaccine, you can still take this vaccine, but you should probably ask your doctor. And if you don't have a doctor, that's okay. Probably when you go to get vaccinated, just let the person vaccinating you know that you've had allergic reactions to other things. That way they'll keep an eye on you for a little bit longer. As a routine for anybody getting one of these vaccines, they have them sit there for 15 minutes just to make sure they're not having any reactions. But for somebody who's had bad allergies to something else, and I don't mean hay fever, I mean allergies to something like a bee sting or a food or a medicine, something that you've taken internally, they ask you to wait 30 minutes. Let's make sure you're okay. Just like the Pfizer and Moderna vaccines, there's no aluminum, mercury, preservatives, eggs, latex, adjuvants. It's just these ingredients and one more. They put in a common cold virus that has been weakened. So it can't give you the cold, but it can carry that gene in. It's like a sneaky way of getting that gene for that spike protein into your cell. All three of these vaccines are excellent. All three of them are highly effective in preventing severe disease, hospitalization, and death. No one who has received these vaccines have died because of the vaccine, and no one who's received these vaccines have died of COVID-19. Now, nothing in life is 100%. I'm sure after we start giving out millions and millions of doses of vaccine, there may be some strange unusual reaction that comes up. But right now, we've had over 75 million people in the United States vaccinated with one of these vaccines. And there have been no serious complications other than some allergic reactions, but we always expected those. So over 75 million people have received these vaccines safely and are protected from severe disease, hospitalization, and death. All three of these vaccines are excellent. So maybe we want to talk a little bit about phase 1B at this point.
Yes.
All right, so phase 1A, what was the deal with phase 1A? Phase 1A, we were really looking to vaccinate older adults. And by older, first we were saying 70 and older, and then we dropped it all the way down to 60 and older, 65 and older, because 70, more than 75%, I think it's 80% of the deaths that we have had in South Carolina were people aged 65 and above. So we really wanted to make sure that we got vaccine to older people, vaccine to people in nursing homes, because I think 40% of the deaths we've had in South Carolina were in people in nursing homes. So we want to make sure we had nursing home residents and offered vaccine to the people who work in nursing homes and to workers in healthcare settings. And that's, EMS, nurses' aides, orderlies, pharmacists, doctors and nurses. It's a big group of people. It's probably, I think it's been estimated 1.3 million people were fit in phase 1A. Now, not everybody decided to get vaccinated in phase 1A. Some people refuse all vaccines, and that's their decision. A lot of people felt, I want to get vaccinated, but I don't want to go first. I want to see how everybody who gets vaccinated does. And as I said, we've had more than 75 million doses of vaccine nationwide, and more than 1 million doses of vaccine in South Carolina without any serious problems. So I hope those people who are saying, I don't want to go first, I hope they feel comfortable after 75 million doses. You know, how many people need to be vaccinated before you feel comfortable? But some people in phase 1A, they didn't get vaccinated. So we've got enough vaccine that we decided we need to start moving into phase 1B. Phase 1B is a big group of people. What we decided for phase 1B, we were looking at what's going on in South Carolina, and we were looking at what are other states doing as well. And I know CDC made recommendations, different groups made recommendations, but we wanted to see what's been working well in other states, because every state is doing it differently. Right. I'll give you an example. Connecticut, they're just going by age. It was like 75 and over, and after we're done with them, 65 and over, and after we're done with them, 55 and over. They're just going by age. And that's a reasonable way of doing things if you're just thinking about age is the biggest factor for severe disease. But in South Carolina, we wanted to think about some other things as well. We wanted to think about people who are at risk because of their work, that they can't protect themselves from being exposed to SARS-CoV-2. But we also wanted to focus on the fact that some people with certain medical conditions, like chronic medical conditions, like heart disease or diabetes, they are at increased risk of, if they get it, they're going to have more severe disease and a higher risk of death. So we did sort of a combination. And right now we are on the edge, right? Monday, March 8th. If you fit in phase 1B, and there's a lot of people, we're going to talk about who fits in. It's a lot of people. If you're in phase 1B, you can make your appointment. And we are trying to spread vaccines much further in the state. You know, in the very beginning, trying to get vaccine to healthcare workers, for example. Well, a lot of that meant going to the bigger cities because that's where the big hospitals were. So there was more vaccine going there. But now as we move to 1B, where we're talking about people in different work settings, people with different medical conditions, and age 55 and over, we need to get it out more than ever into those rural communities. We know that we need to get it everywhere in South Carolina. Now, we still have some limited doses of vaccine. Not everybody's going to get vaccinated next week. Right. We're getting more vaccine each week. Like we got more of Pfizer and Moderna for this upcoming week than we usually do. And that's good. And I hope that will continue in the future. They're making that vaccine as fast as they can. But, you know, week to week, we never know exactly how many doses we're going to get. Because week to week, honestly, Pfizer and Moderna don't know how many vaccines they're going to be able to produce, because they don't just make it and send it out. They have to do quality testing to make sure that there's no batch that maybe got messed up because it wasn't kept cold enough or something. They have to do quality testing. So we never know for certain how much vaccine we'll get week to week. And, you know, as you saw just recently with Mother Nature, played a role in stopping the flow of vaccine, that we had a little shortage because they literally could not get vaccine physically to South Carolina, because some of the manufacturers are in northern states, and they had weather that stopped them from shipping vaccines. So there's always going to be kind of these glitches, so that week to week, honestly, it's not going to be completely smooth, and we all just need to be prepared for that. That, you know, you might have an appointment to get your shot and then it gets moved a little bit later. I do want to remind people, if you're due for your second shot and they had to move your appointment a little bit later, it's okay. That second shot, you don't want to give it too early. It won't work if it comes too early. But if it needs to be delayed a little bit, a week or more later, it's okay. It'll still work. Vaccine will still take. You don't need to start the series over again. Now, I mentioned the Janssen or Johnson & Johnson vaccine, and I said what part of the beauty of this vaccine is that it doesn't need to be frozen. You can just keep it refrigerated and it'll last a long, long time. What's the other real beauty of this vaccine? Anybody know? What's the other?
One shot.
One and you're done. That's right. You don't need to make a second appointment. You don't need to get another shot. You get one shot and you're done. And it is still, as I said, highly effective for preventing severe disease, hospitalization, and death. So and actually also looking at what's reported in their studies, it looks like it doesn't produce as much in the way of symptoms after a single shot. You know, Pfizer and Moderna, just got to be honest, Some people don't have any problem at all. Other people have said, especially after that second shot, that their arm hurt, felt really tired. They had to take a day off from work just to rest. This didn't happen for everybody. A lot of people had no problem. But for the Johnson & Johnson or the Janssen vaccine, it seems like much milder symptoms. People still get a sore arm, tired, headache, don't feel great, feeling achy all over, but that's just for a day or two. But single dose wonder, boy, that has some real advantages. And what we've done in South Carolina, we've gotten this week, we got a little more than 43,000 doses of that vaccine. And remember, it's one shot, so that's 43,000 people who can get fully vaccinated. Then, because this can be kept just in a regular refrigerator, most of that vaccine went out to all those small independent pharmacies around the state, the kind that we call kind of mom and pop pharmacies. They're not part of a chain retail. They're just, one at a time pharmacies. We didn't have enough to go to every pharmacy in the state, but 125 additional small pharmacies have gotten this vaccine so that they can offer that in their community. Yes. We also had a small amount of vaccine that was available that went to CVS and to Walgreens. So I went on our website just this morning to look and see, is it available? Like, can I make an appointment right now? Well, if you're in phase 1A, if you're 65 and older or work in a healthcare setting, you can make your appointment today, and you can make an appointment for that one-time vaccine. Wow. If you're in phase 1B, you got to wait until Monday. So let's talk about who is in phase 1B. Yeah. We've got this on our website. So I'm going to talk about it, but I'm also going to direct you to a website where you can look so you can read up on it for yourself. So folks in 1B include people age 55 and older, people who have certain medical conditions. Now, this is not every medical condition under the sun. This is based on, do we have information from CDC or from other sources about which people, which medical conditions are more likely to have severe disease if they catch this virus? Because it's not true for everything. It's really kind of interesting. Even people with asthma, you would think, oh my gosh, if you had asthma, you get this virus, wouldn't you have much worse disease? Not as much as some other medical conditions. So if you have, regardless of your age, 16 to 54, if you have one of the following, you're in 1B. If you have cancer, now I don't mean a history of cancer, that you had breast cancer 10 years ago and you're recovered and you're cancer free. I mean, if you currently have cancer, any kind of cancer. If you have diabetes, and again, I mean any kind of diabetes, that could be type 1 or type 2, or gestational diabetes, the diabetes you get during pregnancy. And in fact, we are offering vaccine for pregnant women. And here's why. Theoretically, there should be no risk of these vaccines for pregnant women. We give all sorts of other vaccines to pregnant women. We offer them flu vaccine, pneumonia vaccine, tetanus vaccine. The vaccines you don't want to give to a pregnant woman is a live virus vaccine, because that virus could pass from the mother to the unborn child. None of these vaccines are live virus vaccines. So, of course, they didn't test the vaccines in pregnant women. They did test them in pregnant animals, and there was no problem. They didn't test it in pregnant women. But by now, 75 million people have had doses of these vaccines. Some of them were pregnant women, and CDC is following that. There have not been any bad outcomes of pregnancy associated with the vaccine. COVID-19 disease, on the other hand, is a bad disease in pregnancy. Pregnant woman is just by being pregnant, it changes your immune system and you're at more risk of having severe disease. So that's why not just DHEC and not just CDC, but we also, the American College of Obstetrics and Gynecology, the Society of Fetal and Maternal Medicine, they are all recommending that women who are pregnant be offered vaccine. They can talk to their individual healthcare provider if they want to, but the risk with COVID-19 and pregnancy is true, we don't see any risk for getting this vaccine. So we recommend it for pregnancy too. Other conditions, people with heart disease, liver disease, kidney disease, lung disease. Now that's a lot of people in South Carolina.
Yes.
And even obesity by itself, even if you don't have any of those medical conditions, there is something about being obese, and that there's a technical term for that. That's that body mass index more than 30. They are at increased risk. They're a little different immune system, little different reaction to this virus, where they get more inflammation, more severe disease. There are a few other conditions in there, but rather than going through all those medical conditions, I would suggest take a look at our website so you can see what those medical conditions are. There are other people in phase 1B, and those are frontline essential workers, frontline workers. Now, what do I mean by a frontline worker? Well, I don't mean the people who telework. I don't mean the people who are able to do their job without leaving their home. They might be at increased risk of getting exposed when they go, to the grocery store. But that's community level risk. So we want to get them vaccinated as soon as we can. But first, we've got to vaccinate the people who are at increased exposure. So who's a frontline worker? A frontline worker is somebody who has to physically go to work, and they're exposed to other people. They're within 6 feet of other people for at least 15 minutes or longer. And that's a lot of folks, right? Now, some factories have been able to, kind of re-engineer how they were doing things so that they can keep people more than 6 feet apart from each other. And that's great. So that's not who we mean by frontline worker. But what about the checkout clerk at the grocery store? And we know some people, they're not wearing their masks when they're dealing with that checkout clerk. So that checkout clerk is at increased risk. That checkout clerk is in phase 1B. Some people work in settings like the poultry and meat packing industry, where they can't engineer, they can't change the way they do that business. So people are kind of packed in there. They're at increased risk. And we're working with those employers to make sure, let's have an on-site, clinic to make sure we get those people in those settings vaccinated. There are some other groups in phase 1B, like people who are inmates in correctional facilities, people who live in group homes, in certain psychiatric facilities where they're all living together in one group. So that's part of it. That's in there as well. But we're working with those facilities. I think the biggest message I want to get to people, your listeners, is that if you have a medical condition, if you're over age 55, even if you don't have a medical condition, or if you're one of those frontline workers, you can start making an appointment as soon as Monday. Now, we know, you can imagine what's going to happen on Monday, right? Everybody's going to be going online. So it might be frustrating at first to find yourself a vaccine. But there'll also be some mass vaccination clinics. So, keep your eye out for that. There may be a clinic coming near you. And it's true. We're not going to get everybody in 1B vaccinated in the first week, not in the first several weeks, because there's probably more than 2 million people in that group. Now, not all of them are going to want to get vaccinated. So my message to you is, if you go on, say, the Walgreens website to sign up for vaccine, and you get a message that says, we're receiving a tremendous number of requests, please wait. And I did this morning just to test the system. And I use CVS, but it doesn't matter. This is going to be, everybody's got a little different system. They're all going to be facing this reality of a lot of people asking for vaccine, trying to make appointments. There are going to be some delays. Be patient, be persistent. So we have on our website something called a Vax Locator. And that's a kind of a one-stop shop in a way where you can look for vaccine near you. So when you go to the Vax Locator, and we'll give you the URL in a moment, what you'll get is a screen that says, you can click on a box that says, am I eligible? And it'll have that list of who is eligible in 1B. But then it'll ask, you can put in your zip code, and it'll tell you how many facilities, how many places you could get vaccinated near you. So I did that for me, and I got a list of 75 different places. which was terrific. I just turned off my phone. Sorry, people. Have to talk to you later. I put in my zip code and it gave me an offering of 75 different places. And so I just typed in CVS. But, they gave me not only a list of places, but which vaccine they were offering, which was kind of nice. If you were, we're not recommending that people shop around for vaccines. All of these vaccines are terrific. So, the best vaccine to take is the one that you can get soonest. So if you go in there and you're looking around and you say, oh, I can't get this one, but I could get that one, get the one you can get soonest would be my recommendation.
Yes.
But I looked at that and then I just, for example, just to try it out, typed in CVS and they asked me certain questions, where I type in the answers and then they gave me dates and times. And then I just, could click and make an appointment. So I know in the beginning it's going to be tough because lots of people will be going in at the same time, but I would just say be persistent. Don't get frustrated. Sometimes you just got to wait your turn. But I feel really good about, we've got 3 kinds of vaccines out there. More supplies are coming. We're going to be able to get them out to more mobile units into rural communities. So I know people have been waiting a long time, and here I am saying you may need to wait a little bit longer, but we're getting there. We're getting there.
So, Dr. Kelly, I got a question because, we're going into the next phase starting Monday, and there's going to be a lot of people that says that, I got pre-existing conditions. Are people required to prove that condition in order to get the vaccine, or what is the recommendation whenever we're making these appointments? How do we verify, or should we verify whether these people meet the criteria for phase 1B?
We're asking people to be honest. So we're asking people, think about what I said about who's a frontline worker and be honest. I telework. I'm not a frontline worker. I'm not going to go get vaccinated because I'm sitting in my living room right now. So I'm less urgent than somebody else. So we're asking people to be honest think about whether you're a frontline worker in terms of medical. So we're only going to ask self-attestation. You don't need to bring a note from your employer. Some places some of the big employers are going to set up worksite vaccination clinics. And so they're going to think about, wait a minute, you're in the back office. It's not your turn. You're in the front line. So that might be handled differently at a worksite clinic. But we are not asking anybody to bring a note proving that they're a frontline worker. Same thing with, we're not asking anybody to bring a note from their doctor verifying that they have, for example, diabetes or heart disease, because, we're worried that might discriminate against the people who don't have a doctor. There are a lot of people who have medical conditions, but they don't have a regular doctor. They just go to the emergency room or urgent care, or, some folks, they're not taking care of their medical conditions, for a lot of different reasons. And those are the people you want the most to vaccinate. If you got diabetes and you're not taking care of it, that's the person you need most urgently. So we don't want to create a barrier. We want to make it easy for people to access vaccine. So you do not need to bring proof from your doctor or bring your medication with you. Some people aren't on medications and yet they've got medical conditions. You don't need to bring proof of a pregnancy test. We're going to ask people to be honest. When they sign up online, they'll be asked, why do you think you belong in 1B? And so you'll put in your information about why you're in 1B. There'll be some specific questions. And that helps us also so we can keep track. We have some estimates of, how many people in the state have heart disease, for example. And we can look and see, gosh, how come we're not getting through to the people with heart disease? Why are they not signing up? Or, different things, just like we try and keep track of age or race, ethnicity, who's signing up, so we can get communication out to them. Maybe they don't know that they're at risk. So, we want to reach more of them. But we are not asking for proof. We're asking people to be honest, sign up online. Now, when you get to the place where they're going to give you vaccine, they might ask you again, how do you fit in 1B? But they should not ask for any kind of proof.
Okay. And then, and in line with that, in light of some recent events that happened on the news where some vaccinating organizations may have gotten into trouble for vaccinating the wrong people, would there be a penalty to the company, to the corporations, or to the places that are giving vaccines during this phase, because they might not know, and they may give it to somebody who don't qualify for phase 1B, but based on that person's word, and it gets back to the powers that be, would that place be penalized or not giving vaccines again?
It's tough. This phase 1B is different from phase 1A. What happened in phase 1A is, you're absolutely right. There were some places that were vaccinating folks that they shouldn't have. Folks who were administrators, not people who, it's like my reference to teleworking, folks who were administrators, they're not workers in healthcare settings, they're not critical personnel. And that was a problem. And, that not unique to South Carolina. In Georgia, they did that, and they just cut them off. They said, well, we're not sending you any more vaccine for, I think it was like 6 months. I mean, they just cut them off. Yeah. We don't want to be punitive. We don't want to punish sites, but we want to remind vaccinators that, we got to do this in steps so that we get vaccine to the people who need it the most earliest. So for example, sites in South Carolina that, vaccinated folks out of turn. And, I don't mean a couple of people out of turn. For example, I mean, if you're a, vaccine site and you've got, your open vial of vaccine and it's going to expire, and if you don't get it into somebody's arm, you're going to have to throw it away. Well, get it into somebody's arm. But that's just a few people, and maybe they weren't in that right phase, but that's okay. Better to use the vaccine than to waste it. But there have been some places where they vaccinated a whole group of folks who didn't fit in 1A. And I have sympathy for it. There are places where they were vaccinating, for example, a group of school teachers. Well, I understand their thinking, but it's not the right thing to do. If we're vaccinating out, and so we've told them you can't do that. And so we've got to give you a decreased amount of vaccine, because if you're not going to do the right thing, we've got to give it to the people who are going to do the right thing. Mm-hmm. So we don't want to cut anybody off. The goal here is to get everybody in South Carolina vaccinated who wants to get vaccinated, but with such limited amounts, we got to do it right and do it within phase 1B. Now, when we're asking people to just self-declare, I'm a frontline worker, or I have one of these medical conditions, it's going to be really hard for a vaccinator to know. We're not asking for proof. So it's going to be tough to say whether they gave it to someone they shouldn't have, unless there are, really blatant examples, like vaccinating the whole high school football team that's age 16 and older. Come on, do all of them have diabetes? Do all these football players, are they all, they all have medical conditions? How come they got vaccinated? So there might be circumstances where you'd have to question, wait a minute, this sounds fishy to me.
Turf toe, knee injury. No.
No. Sorry.
I tried, y'all.
Orthopedic injury, doesn't place you at increased risk of severe disease.
And so, Dr. Kelly, as we get into, we see the numbers are dropping, the numbers are lowering. Some questions came up, and I heard some conversations around about people who are curious now that everybody's, and I hope that they're just being really, really careful, but people are starting to do more activities outside the house. Like they're starting to gather more, and hopefully they're being more careful. But a question came up about getting the virus from food or from those type of surfaces. Like for instance, a birthday party, somebody's blowing out a cake or blowing out a candle, and people are getting slices of the cake. Can I get COVID-19 from that slice of cake because that person tested positive and they blew a candle out? So what is the possibility of me getting?
Well, now that's a really interesting example, because I'm not worried about the cake. Mm-hmm. I'm worried about the blowing. So, okay, somebody blows out the candles and you eat a piece of that cake. I'm not worried that eating that piece of cake is going to give you this disease, because the virus, it's a respiratory virus. The acid in your stomach, if you swallowed some virus on a piece of cake, that it's going to get destroyed. I'm not worried about that. I'm worried about blowing out the candles though, because that's forcible, anything where you are forcible breathing, singing, shouting, blowing out the candles, that spreads virus. You may have no symptoms and not know that you're contagious, but now you have launched a bunch of droplets and virus into the atmosphere. And so it's not the cake I'm worried about. I'm worried about you sitting on the other side of the table that that person just blew a bunch of virus over to you. Right. So, you know, I hate to be a killjoy, but I would say no more, don't blow the candles out right now. You know, take a cloth and wave it over it or something to blow out those candles, but don't be blowing out the candles with your breath.
Okay.
But to your bigger question about what about food? What about takeout? You know, I get takeout. Do I, you know, don't I need to worry about that? What about the mail? What about, you know, I buy groceries and bring them in the house? Do I need to, you know, sterilize the packaging? In the early days of this, we didn't know the answers to any of those questions. And so we were really conservative, right? We were saying, you know, maybe quarantine materials, you know, let it just sit there for 24 hours, or maybe wipe all of these surfaces down with disinfectant. I think as time has gone on, we've realized more and more it is droplet spread. It's respiratory spread. So if you want to bring your groceries home and have them just sit on the counter and not touch them for a while, that's fine. Or if you want to, you know, wipe down packages with a disinfecting wipe, okay. But you know what? It's probably not necessary. It is important to know, do not use disinfecting wipes on your fruits and vegetables. I mean, these things have chemicals in them that you don't want to be swallowing. So the important things are protecting your respiratory system with that, wearing a mask and distancing. And after you've been out shopping, you come home, wash your hands. Yeah. I mean, the first thing I do when I come home is I walk in the bathroom and I take off my mask using just my ear loops, take off my mask and I drop it in the sink. And I wash my hands and wash my mask right then and there. Some people, they've got lots of masks and they'll put them in the laundry and do it with the routine laundry. But, you know, hand washing, soap and water destroys this virus. It breaks down its coat. So, you know, regular washing, 22 seconds, you know, sing happy birthday, all that stuff that applies to hand washing applies to mask washing as well.
Oh, okay.
That's pretty good.
Yeah. Okay.
Sticking your mask, you know, some people think, oh, I stick my mask in the sun and doesn't the ultraviolet rays destroy the virus? Yeah, somewhat, yes. But remember, virus got carried in there on mucus droplets. So it's a little bit protected from those ultraviolet rays from the sun. Plain soap and water is much better. So plain soap and water.
Well, I know this is a off the hip question, but how often do you recommend that a person, if I'm wearing a mask, the disposable mask, like, you know, for instance, this mask, how often do you recommend, or is it recommended how often I change that mask? Because we touch that mask a lot. We take it off and we lay it down on the surface. We pick it back up and we put it back on our face. What's recommended with those masks?
So the mask that you just showed, surgical mask or procedural mask, it looks like it's a simple paper mask, but actually it's got 3 layers. And the middle layer has kind of a special woven material to help stop virus. So those are excellent masks. But you're right, people take them on and off like to eat or to drink something. And it's recommended that as long as it's not dirty or wet, because if it gets dirty or wet, it's not going to work as well. So if you put it down, accidentally put it down in, you know, a puddle on the table from, you know, a water glass or something, and now it's wet, it's no good. You need to toss it and get another one. Otherwise, the usual recommendation is at the end of the day, throw it away. So if it gets dirty or wet, it's not as protective. Otherwise, get a new mask, one of those paper masks every day. If you use a cloth mask, which is what I do, then, you know, you wash it at the end of every day.
Okay. Yeah. Speaking of masks, just kind of piggyback on that, the cloth mask. I know one time before you were on here, you talked about the recommendation for a cloth mask. So I'm gonna test my recommendation right now. So I have this cloth mask here, and it's a double layer mask, but it also has a pocket for a filter, which I have a filter in it. So would that be an acceptable? And it has the side, you know, the side elastic that kind of keeps it snug on the face. Is that something that would be most recommended?
The best masks are the ones that have the ear loops that are adjustable.
Right.
So you got like a little slide on it so you can adjust it to your face, because everybody's face is different. Has a metal nose bridge, a metal wire right at the nose so you can squish it. So it really, and if your mask doesn't have one, you can buy them. You can buy them on Amazon. You can buy metal nose pieces that have adhesive so you can stick it on your mask. You don't have to get a whole new mask. You can just get the nose piece. The 2 layers with a pocket so you can stick another piece of material in there. That's ideal. But show me that mask again. There was one other feature about that mask that worries me a little bit. Does that have a valve? Yeah, the valve is a problem. Now, I have to be honest. The first mask I ever bought, which was way back in March, because I knew that this was coming, I bought one that had one of those valves. It does make it easier to breathe, but it's a problem.
Okay.
The way that valve works is it's a one-way valve. So it protects you. When you breathe in, you don't get anything through the valve. Everything you breathe in comes through the mask. But when you breathe out, it goes out through that valve. So it doesn't protect the other guy.
Oh, okay.
So I know those valves, they were all the rage, and I bought one too, but I've gotten rid of mine. It's not the best mask for protecting people in society as a whole.
Trash
I
can.
got one too.
I know. Everybody got them because they look great, but it's a problem. Sorry, but no, they're a problem because they can spread disease. If you're contagious and you don't even know it, it could spread it, the virus.
Got you. Okay.
That's good to know. That's because you see a lot of those going on. People wearing those
and people don't know. People don't know. So, if they're to the extent that you feel comfortable telling someone, that's not really the best mask, because there's so many different masks out there. So the best mask is one that fits your face. And that's one that has those extra features where you can adjust it to fit your face, like the ear loops and the nose thing. At least 2 layers. If you've got one that's got a pocket where you can stick in that 3rd layer, that's even better. And avoid the valves because it protects you, but it doesn't protect the other guy. And we're all in this together.
We're all in this together. That's right.
That's right.
Yes.
That's right.
And if we can go back to something you had mentioned earlier, and I'm just curious, because I wanted to kind of expound on that. You were talking about you just recommend any vaccine if you can get your hands on any vaccine to take it. So I'm a graduate of the Google School of Medicine, and
Dr. Marek.
Hey, you
a lot of people went to that university. A lot of people.
Yeah, if you take my name in CareSouth, it actually comes up as MD. I don't know how that ever happened. I guess because I was site manager here, but here was my thought. Here was my thought, and tell me if I'm misguided. It's not. I tested positive for COVID back in November, right? And I'm sure I have some immunities built up at some point. So my thought was, okay, I'm gonna get the Johnson & Johnson. It may not be as have the high efficacy number that the other 2 have, but with my immunity that I may have from having tested positive before, along with that, I'm good. Am I thinking wrong?
You're not thinking wrong. And this is a really interesting question that they're doing research on right now. If you had COVID-19 before, it is recommended that you get vaccinated. Why? Because there are lots of studies that show that the amount of antibodies that you get with the vaccine are even higher than the amount of antibodies you get with the infection. They have really built this into all 3 of these vaccines that they're going to give you literally, in some cases, 10 times higher amount of antibodies produced than would be produced on average for for having the illness. So definitely getting vaccinated is recommended. If you've previously had infection, do you really need 2 doses? Or could you do just as well with just a single vaccine? You're asking a very good question. And there's a lot of research going on that right now. And I know CDC, NIH, FDA, they're all looking at that data. So we've got, because we want to make a data-driven,
Right.
prove it to me in a study, evidence-based decision. So they are looking at that. And I have to say that, some of those results are interesting. It might be that you don't really need 2 doses. Right now, because this disease is so bad, some people died. I mean, we've had 500,000 people in the United States die from this disease. We're being extra careful. So right now, our recommendation is if you get Pfizer or Moderna, they tested that as a 2-dose vaccine. Don't just get 1 dose and think you're safe. If you get Pfizer or Moderna, get both doses. In answer to your question about, well, if I had COVID before and I just get Johnson & Johnson, is that good thinking? It is reasonable thinking. I understand the biology,
Right.
but I can't recommend one vaccine over another
Right.
at this time for people. But they are looking into it, and it might be that a different recommendation will come out. My worry here, and this is the thing I want to emphasize. Now, if a person we know that there are people out there who get 1 dose of vaccine, and it's going to be hard for them to come back and get a 2nd dose.
Yeah.
Either they've got transportation issues, can't take time off from work. They may have other, reasons. There are even things like mental health issues where it's going to be tough for people to come back, get that 2nd shot, or they're homeless. There are lots of other factors figuring in here. What we want to make sure we avoid is people shopping around for vaccine, and that delays them. So let's say you go online, you want Johnson & Johnson, and you say, wow, gee, I can get an appointment next week for either Pfizer or Moderna, but it's going to be 3-4 weeks before I can get Johnson & Johnson because we don't have enough. It would be a shame, I think, to wait 3-4 weeks to get vaccinated. But it's a person. What you're saying makes sense. It's not the current recommendation because we're really worried people are going to delay. The best vaccine is the one that you can get as soon as possible. But what you're saying makes sense, and they are looking into that.
Okay. So folks get whatever vaccines that's available to you immediately.
That's it.
Yeah.
So, and that brings us to another question. You said that some people only get the 1. What about? And I heard somebody say this. Well, if I can't get my 2nd one, that's Moderna, then I just go and find somebody that's giving the Pfizer, and I get 1 Pfizer and 1 Moderna. So
we don't recommend mixing and matching because nobody's done that study.
Right.
In theory, what I know about the biology and the immunology of this, in theory, it should be fine to do that, but we don't recommend it because it's not been proven. And also because it creates a lot of logistics mix up. Because when a vaccine provider orders their doses of first vaccines, then they've also got kind of programmed in that, okay, I gave 100 people this vaccine and they're all going to come back in 3 weeks. So I got to have vaccine for them in 3 weeks. And if you show up 3 weeks at that period and you got vaccinated someplace else, you come in, it's going to mess up their numbers. They're not going to have enough vaccine to give it to everybody that they vaccinated the first time. So sorry if that was a confusing explanation.
No, that was very clear. And I got one more question about the vaccine. You said, okay, so if whenever they give us the vaccines and it says you got 100 doses, and we understand that in those vials that you can get sometime an extra dose.
Yeah.
And then whenever you're doing your inventory, like when you're doing your count on VAMs or your VAMs or whatever, you end up with a negative number, right? Because you gave so many. You gave more than what you was given because maybe you pull 5 extra doses out of those 100. So now you have 105, where in your inventory it says you have 100. How is that reconciled?
So you are absolutely right. This can be a challenge, and because we didn't anticipate this in the very beginning, it was especially a challenge in the beginning. But now that we know that people routinely get a certain number of additional doses out of some of the vials, we've got that built in our system. So what happens is the vaccine provider, the person who is giving the doses of vaccine, they place an order for a certain number of first doses and second doses. So they can place their request, and they can indicate, oh, I actually got 106 doses, not just 100 doses of vaccine. And some places are really good at it. They're getting, 125 out instead of 100 doses out of their vials. So, but we have a way now of dealing with it. It was a little bit confusing in the beginning because we hadn't anticipated this, but there is a system. Unfortunately, guys, I have a 1 o'clock where I'm talking to yet a different group, but I love talking with you, and I wish I could stay on longer. So I hope that you just invite me back so we can chat a little bit more. This will be interesting to see what happens with the Johnson & Johnson. I could see it both ways. I could see people saying, I don't know if that vaccine is as good. I know this vaccine is as good, but I know there's word out on social media. People listen to all sorts of different things. But I think there are also going to be people who are completely the other way, who are like, one and done. That's the vaccine for me. So, I hope you invite me back and we can talk about what we're finding out in real time.
You can count on that.
I want to say one more thing. Sorry. Even after you are fully vaccinated, by that I mean 2 weeks after you get your single dose of the Johnson & Johnson, or 2 weeks after you get your second dose of the Pfizer and Moderna, please still wear a mask. You're protected, but you might, if you were exposed to the SARS-CoV-2 virus, you might get infected, be completely without symptoms, and yet be contagious and not know it. So even after you're it's like wearing a mask with a valve. It protects you, but it doesn't protect the other guy. The vaccines protect you, but that doesn't necessarily protect the other guy. So our recommendation is still, this is not going to be for forever, right? Vaccine rollout is going to be over the next few months. We've come this far. We've been doing this for a year. We can do this for another few months. So even after you're fully vaccinated, please continue to do all the things you've been doing about, protecting not just yourself, protecting the other guy with wear a mask, keep your distance, avoid crowded indoor spaces.
Wonderful. Good advice. And so, but you can bank on this. You can count on this, Dr. Kelly, that we are going to have you back.
All right, cool.
You bank on that.
Thank you so much for inviting me. I'm sorry to be abruptly running, but
that's all right.
Got some other folks to talk to. Thank you, everything, for all that you're doing.
Yes, ma'am. You have a wonderful weekend.
Yeah, thank you. You too. You too.
All right. Bye-bye.
Bye-bye.
All right.
All right, man. Hey, I love having Dr. Kelly on, man. I love having good information.
Absolutely. She's just a wealth of information, that in good information, accurate information, trusted information that's why we reach out to her to get her on here, and we're going to continue to have her on periodically to give us some updates on new information on things that's coming out.
That's right, because just her title, epidemiologist, the study of disease and everything else, that's her business. So what we're living through is her business. So why not get the person whose business this is to give us the information about this, what we're going through now. So we really appreciate her time to come. She's a busy woman. So we appreciate her time coming to help us out. Really.
Absolutely. And so, just like she said, once you get those your vaccines, whether it's Johnson & Johnson or Moderna or Pfizer, once you get that second vaccine and you wait to 2 weeks later, please continue to wear your mask. Please continue social distance. Wash your hands with everything that you were doing before, because at some point, once everyone's vaccinated, and I think the numbers thrown around is 75-80% to reach herd immunity. We can probably see some relief in having to wear the mask and getting some sense of normalcy back. So I'm looking for that day. I'm hoping for that day.
That's right. And that follows the message that we're trying to put out in everybody. Don't wait. Vaccinate. If you're tired of these masks, if you're tired of being isolated from your family, your loved ones, don't wait. Vaccinate. Find you somewhere that's vaccinating. And if you fit into these categories, go ahead and get the shot. I got mine, and no issues. Some people had minor issues, but I'd rather have those minor issues now than to deal with what COVID is doing to people a little later on. So don't wait, vaccinate, please.
Absolutely. And so I'm excited about having the vaccines, and especially with the Johnson or Jensen vaccine being as one dose, it's going to really that's the game changer, like she said, for those small mom and pop pharmacies to be able to be added to the list of vaccinated. So that's going to increase the ability for more and more folks to be vaccinated, and also, to be able to deploy maybe the Johnson and Johnson. If we're fortunate enough as an organization, be able to get that, to be able to deploy that on the mobiles that we have, and go into some of the rural communities with our mobile vans that we have available to be able to vaccinate folks in the more rural community that may have an issue, or some transportation problems, maybe homebound, that type of thing. So hopefully, that's all I say. Hopefully,
Well,
hopefully
but
change.
think about it, Marek. In some cases, we only get one shot.
Yes.
And so why not make that one shot our best shot, right?
Yes.
Because we might can't
Absolutely.
find it the second time around. So hopefully it will work in our benefit that vaccine goes on the Mobies, and we're able to do that just that one time, just that one encounter that we have with whoever at that point can save so many lives in that community, because we're not promised that second opportunity.
All right. Absolutely. And I know we're going to in Dillon County, we're going to be testing mobile vaccination, um, potentially next Thursday, and we're going to start in the Dillon County area. We're going to have limited vaccines on the mobile, so it's not going to be one of the larger events that we do in the sites. It's going to be very limited, and so far as maybe 20, 25 shots at the most that's going to be able to be given on the Mobi. You preferably in the afternoon, starting at between 1 and 4, at the various locations where the Dillon County Mobi is going to be, and folks can find that location on our our website. Scroll all the way down to the bottom and find calendar, and click the calendar, and all of that information is going to be there. So I'm excited to be able to pilot that and see, be able to reach out into the community, rural areas, and be able to vaccinate on that Mobi. We already test on the Mobi, so we'll still be testing in the morning times. We'll be changing the times of the Mobis from 8:30 to 11, to be able to test, and that'll give the staff time to get any testing specimens to the DHEC for pickup, and as well, get them a little bit of respite so they can get them a little break, a little lunch, and then we'll be set up, and then get set up in the afternoon to do some some vaccinations. So I'm excited to see that happen, and then potentially, as we work out the kinks and pilot that here, we can expand it to some of our other areas. So I'm excited for that. I'm excited for that. That's taking that next step. You know what I mean?
That's right. And so, Marek, and in doing this, which I think is a wonderful thing, getting out in the community doing this. But we also need some help from some of our community partners, because we need places, visible places, and more with more traffic to have these movies parked, so we can encounter more people. So if anybody out there know of parking lots or businesses that have larger parking lots that might be able to hold that type of traffic, please contact us, and Marek can give you the information at the end of the end of the podcast, and contact him and let him know we have this space available in Dillon County where you can park, or this space available wherever, and that way it increases our visibility for people that might need the services that we're offering on the Mobies.
Absolutely, and that would definitely be great. And we'll probably be doing some outreach for different organizations like churches and different things to possibly look at that possibility. But in the meantime, between time, you can reach us at 843 correction 1-866-498-0399. 866-498-0399 if you're one of those organizations that Daniel just spoke about. So I'm excited. I can't wait. It's going to be great. Like you said, don't wait, vaccinate. So with the emergence of Monday 1B, phase 1B opening up, that means we're at CareSouth. We're going to be opening up more appointment spots at our locations to be able to accommodate the influx of folks. So if you hadn't made your appointment and you fit into 1B, and you can go to the DHEC website. You look, I posted it here on the web in the comments. Go to the DHEC website and see if you qualify for 1B, and if you're in one of our service areas. And again, we cover Darlington, Marlboro, Chesterfield, Dillon, and what I Lee County. There you go.
Lee County, yeah.
Yeah, Lee
Yeah.
County. If you're one of those in those areas and you hadn't made your appointment and you fall under phase 1B, hey, give us a call. Give us a call. You can call any Care South Carolina office location, and it will direct you to where you can make that appointment. Okay. Um,
And Marek, one thing, when you make your appointment, please make sure that you keep your appointment and not just, like some people make several appointments at several different places. And then once they find the closest one or the earliest appointment, they forget to call and cancel their second appointment. And that's an opportunity in the spot that somebody else could have. But because you didn't cancel it, then we have to, at the end of the day, we have to find somebody to fill that spot. So as a courtesy to your fellow citizens and fellow community people, make sure that you stay in touch with the facility that you made your initial appointment with and cancel if you find another one, just so we can have enough vaccines for everybody. So, and be patient during this process because there's a lot of people that want to be here. So let's try to be a little more patient with the staff and the facilities that's offering it, and they would get you in as soon as possible. So hopefully having this additional phase open up is going to open up a lot of those people who are on the waiting list because they just might fit into some of those appointments that we have available starting on Monday.
Absolutely. And again, make sure you follow all guidelines, everything. We want folks to be safe out there. We want people to, make it through this virus. It's touching so many lives, and I just unfortunately lost an uncle the last couple of days. So keep my family in your prayers, and keep all those other families in your prayers that's lost loved ones to this virus. Please be safe.
Please.
Safe. Yep.
Yeah. Sorry for your loss, Marek.
Yeah, I appreciate it, bro. I don't know anything else you want to put out there before we close out.
Well, everybody just be careful this weekend. The sun is out, no rain. It's going to be a little cooler, but let's not get complacent in what we're doing. Let's still continue to be safe. Let's still continue to be mindful of what we're facing out there. We're still in the pandemic, even though the numbers are decreasing. There's a spring break is coming up, and we want people to be mindful that we still don't need to have large gatherings. It's still an opportunity to party. Still an opportunity to be kind of just mindless about everybody else's safety around you. So let's continue doing what we're doing, decreasing the numbers so that we can get back to some sense of normalcy where we can, like I said earlier, spend time with our family out in public, and where I can go to Outback and sit down and eat me a steak, right? Sit down and eat me a steak and don't have to worry about anything going on around me. I can enjoy my steak. So let's get it together. Let's do it. Let's do it. We're in this together. Come on.
Yes, sir. That's right. I can't wait. And speaking of steak, man, I cooked steak last night. I ain't gonna get into that. My bad.
We'll talk when the cameras go off.
But anyway, we will close out for the day, yeah, because this might turn into a cooking session. You know how we like to do.
Yes.
But so anyway, so thank you for tuning in today to CareSouth Carolina Community Live Podcast. Again, I'm Mark Calhoun, Director of Social and Community Services, and my partner in crime is
Daniel Myers, MATHD Program Director, CareSouth Carolina. Thank you, guys.
Yep, and enjoy your weekend. You want more information about CareSouth Carolina? You can give us you can reach us on our website at www.caresouth-carolina.com. Our new revamped website at www.caresouth-carolina.com, and you can also reach us toll free 866-498-0399. 866-498-0399. And if you want more information about CareSouth Carolina, all right. All right.
See it.
Have a great weekend, y'all.
Goodbye, everybody.